İşte Hayat izleyicileri, programımıza İstanbul Aksaray'da faaliyet gösteren JS Dental Ağız ve Diş Sağlığı Kliniğinde konuk olarak devam ediyoruz.
Hi, I am Dr. Ağiz. I'm a periodontics specialist graduated from Istanbul University, the Faculty of Dentistry. Let me share with you about my specialty. Periodontics specialist is involved with treating the gum and the bone infections, diseases, replacing the missing teeth with the dental implants, all the surgical procedures including the aesthetic and the preventive ones. In our clinic, we have 7 specialized doctors treating almost all the dental procedures and treatment needed. We are well experienced to deliver almost all the dental procedures in high standards and a maximum patient satisfaction. Dental implants are safely placed on all candidates from 18 years old and above. Dental implants can be easily placed on the chair side and the local anesthesia, usually in 1 or 2 steps. The most important point at dental implant procedures is the planning. When the patient comes in, usually we take a 3D image to capture the patient's jaw and the anatomic structure. Then we do oral examination and we reflect it on the oral scanner to reflect the patient's teeth, soft tissues, and the relation between the jaws. Later on, we do the planning on the computerized program to understand the patient's needs and to decide the right number of implants and the position. Later on, we transfer all the information to the surgical guide, which can be used later at the surgical procedure to place the accurate and the most efficient implant situation and position for the patient. After the placement of the implant, we wait for the healing process, which varies between 2 to 3 months. Later on, we use the intraoral scanner to capture the position of the implant, and this image will be transferred to the lab where they make the design which fits the patient's needs and aesthetic outcome. Finally, we receive the final restoration and will be finally delivered to the patient. The whole journey between the planning and the final restoration, it takes about 3 months at maximum 3 or 4 visits. One of the most important points at the implant placement is the planning, because when planning is done correctly, analyzing the patient's needs and the patient's anatomic structure, everything planned on top of this plan will be correctly done. One of the most common problems what we face is placing the implant in the wrong direction or making the wrong decision on how many implants and the position of the implants. When it comes to the wrong application, sometimes the results can be irreversible and cannot be corrected. So choosing the right person and following the right steps will definitely affect the outcome and the final results. In our clinic, we are capable to restore every implant case, starting from one missing tooth, ending up with a full mouth rehabilitation. We have also a very qualified dental lab which can easily produce and create all the dental needs matching with the patient's needs and at the same time with their budget. One of the most common questions comes to us that does the implant placement hurts? The answer is no, because it's done under local anesthesia and it's placed inside the bone, which there is no nerve extension. Usually, a discomfort can be happening after the procedure, which can be easily managed by painkillers and the other additional supportive medicines. For those who have extremely fear from the dentist or any dental application, we are qualified to manage such cases. Also, we have the option to add a sedation into this journey to make it very easy, pleasant, and a painless experience for the patient. Smile makeover is the process of improving the appearance of the smile through one or more than one dental procedure, such as veneers, cosmetic bondings, teeth whitening, or dental implants. Before we start to do the smile makeover, we should carefully analyze and understand the case and especially listen to the patient's expectations to create the best result and to get the maximum patient satisfaction. Before we design the case, we should keep in consideration all the information such as the patient's age, skin color, gender, and any other expectations to make the customized design and to create the best possible treatment and smile makeover for the patient. Designing the smile makeover is not only enough because we need at the same time a high quality experienced dental lab to translate all the information that we deliver and to create and produce a high quality, natural looking, good looking teeth or crowns or dental procedures to be delivered for the patient.